Welcome back to the second half of the Rainbow Push. Let's talk about it with Santita Jackson and Friends edition of A Candid Conversation about COVID. Of course, Dr. Deborah Holden, we have not heard from you. You said that this is a time for us to really tackle inequities in the healthcare system. Please explain.
Yeah, so this is, Dr. Walk sort of made fun of me, but this is my thing. I think what COVID did is, Dr. Walk is my guy. What COVID did is it just shined a light on what was already there. Inequity didn't emerge during the COVID pandemic. And the reason that I am on a push to mandate equity, and I want to clarify what I mean when I say mandate equity. We learned some valuable things during the beginning of the COVID crisis around how to mitigate disparities in COVID cases and in COVID deaths. We learned very early on that if people were going to have the ability to isolate or to self-quarantine if they had been exposed, that they would need access, barrier-free access to testing. And we saw tremendous barriers for people having access to testing. Initial testing required that you have a primary care physician or a physician give you a script for a test. Well, if you came into the pandemic and you didn't have a physician, how are you going to get that? And then a lot of the other testing that we created and put out in community to solve that barrier, we created drive-through testing. And very much like a fast food restaurant, you couldn't walk through the site. So if you didn't have a car, you couldn't access that. We created all of these problems that didn't address the real, what I call causes of the causes, which is that we simply live in a world where the playing field is not level, where we have real barriers for people having everything they need to have optimal health and opportunities for optimal access to quality health care. And so my position is that we've got a lot of very hardworking, very smart people doing the work. I sit on the New York task force, I hear what they say. I sit on the Michigan task force, I hear what they say. I sit on my local task force, and time again, what I'm hearing are the tales of good, strong-willed people, community organizations, federally qualified health centers, nurses, community health workers, pushing a boulder uphill to make sure that we get this vaccine to the people who need it the most and that we do it fairly and equitably. What I say is missing is pull. They're pushing the boulder, but there's no policy in place. There's no mandate that says, states, we used our taxpayers' dollars to pay for what's in that vial. You are now required, if you receive these vaccines, to demonstrate that you can get it, not just distribute it, but into people's arms fairly and equitably. That policy would be the pull. I say if it matters, we make it a law. We decided at some point that seatbelts save lives. We all take that as a fact, and we have laws. You must wear your seatbelt. If we say equity matters, all I'm asking for is that we have laws that back that we have pull from our federal government and our state government to honor the tremendous amount of push that we're seeing out in community. And that is why I am committed that we mandate equity.
How does the public health system, what do you do in this moment when we're about to reopen these schools? I mean, that's here. That train has left the station. Whatever our reservations are, the schools are about to be reopened. What should be done to reopen the schools, and what responsibilities does a city, does a state, does a nation have to these children and to the teachers and to everyone who works in that ecosystem, the bus drivers?
So Santita, let me put one of my other hats on. I spent 5 years on the Maryland State Board of Education. And the only thing more diverse than public health across the country is education across the country. The Maryland State Board of Education ran like a corporate board, hired and fired the superintendent. All of the personnel issues came up to the state board. And so you have many boards of education that actually run the education system like a corporate board and are responsible for things like approving construction of school buildings, improvements in school buildings, all of that kind of thing. So this is universal in the government. Know where you are. Understand how your Department of Public Health works. Understand how your Department of Education works. Understand who is responsible for what parts of it, because then you know where to apply the pressure. I may kid Dr. Deborah about that word, but that is our word. It is important for us to make sure that there's equity. But how do we get there? I can spend about a minute celebrating the problem, and then I've got to go to next steps. I'm a next steps kind of guy. And what do we do next? What we do next is we understand that there are people who are accountable. One of my other favorite words, who are accountable for what we are living with, for the schools with the icicles and the water fountains that don't work and all of that. And those people respond to the people that vote. We have got to recognize that our way out of all of this in this United States of America is to vote. And we can't just show up when it's time to vote for the president. We have to show up when it's time to vote for the local judge, when it's time to vote for the local sheriff, when it's time to vote for the mayor and the council people, because in different communities, different people are running those different things that impact our health and impact our resources. So I think it's critical for us to realize that there is something we can do. We can find out, hey, who's running? I had a friend that ran for ANC in one of the communities in DC, just because she said, you know what? Nobody's doing anything. Guess what happened when election time came? Nobody else was running. I think she voted, her husband voted, and she got the position. She now had influence in her community. That can't happen every day, but every day that you decide to know who's running and you decide to know who's in charge of what's bothering you is a day you have an opportunity to fix whatever is wrong in your community. So let's not get too far away from where the power is. The power is in the vote.
Yeah, and the power does rest with us, Dr. McDougall. I mean, that's why you have this public health manifesto. I mean, thank you, Dr. Walks, because the public really do have to get involved. I mean, I think that oftentimes we have been passive about our health. We go see the doctor, particularly only when we really get sick, when we really are hurting. Many of us don't get the annual checkup, which we should do. But now is the time for us to really get involved, in our healthcare, to have discussions about not just our public health, but our personal health, and our public health. Where do you want us to go? Where do you see us going from here, Doctor?
Okay, so another good question. So I'm going to take us back to 1968 and Dr. Martin Luther King's book, Where Do We Go From Here? Chaos or Community? And he speaks to the importance of the Black church, the Black press, Black fraternities and sororities, and Black professional organizations. And so that involves coalition building, that involves engaging people who have relationships with people in the community. That's what we've been expanding upon. The Rainbow Push Coalition, like the listeners to also look at the Black Coalition Against COVID website and the National Medical Association advisory statement on Moderna and Pfizer vaccines. So we're continuing to grow this coalition to speak to the times that we are in today. And I thank you for convening this town hall for Rainbow Push Coalition. And we just need to keep working, keep on that ground game, person to person, having conversations with people in the community. So I think this is all very important.
And I think that you're right. I mean, as we begin to close things out, I do hope, Dr. Deborah Verholden, I'm hoping that you've been in Flint, Michigan. I mean, you have been living in the midst of a city that has challenged you to live in a particular way, because you can't really drink the water. I mean, and we have a lot of Flints, Dr. McDougall, Dr. Walks, and Dr. Knighton all around the country. But it's one thing to hear about it and read about it. It's another thing to live in it. Do you think that's made you, do you think that's really, I would say, has that heightened your activism? I mean, you take these stellar credentials, all of you, but you've gone into the public space. In living in Flint, what kind of tied this up for us tonight?
Living in Flint has changed me in ways that I can only say I'm a better human being having been in Flint. When you realize how much brilliance, how much talent, how much heart, how much just extraordinary, talent and ability there is here, the thought that that would be diminished or taken away from them or, somehow suppressed because it's a city where big business divested or where the governor thought less of us than he did the larger cities like Grand Rapids or East Lansing. It's an honor and a privilege to take that Hopkins PhD and these NIH grants and all of this fierceness and activism and roll it out for these people who are my neighbors and my friends and my colleagues and my partners in the work. If you've never been in a city like Flint, and Flint is not the only Flint, but I have to, just speak for my people. There are many Dr. Verholdens in this city. Some of them are 3 and 4 and 5 years old right now. They deserve the people like me to be fighting and clearing the way for people like them. Because guess what? Somebody did it for me. Yes. I am because you are. I am because of Reverend Jackson. I am because of a Dr. McDougall. So this is just, to me, paying it forward. And it is one of the most profound honors and privileges that I have to use my time, my talents, my treasures to stand with and fight for my people.
You know what? And I think that really wraps it up for us, because Flint is really the United States of America, which is the world. Flint helps us to look at how we really have to function as neighbors, as one, not just individually, but corporately. What responsibilities do we as individuals have, we as communities? What responsibilities do corporations have with all of us? All of these things are interconnected, and we've seen in Flint what happens when things don't go right. But you know what? We hope this conversation will help you to think about what can happen when things go right, when things go well. What can you do? You can do a whole lot. Dr. Waltz, you're right. You can vote about it. In fact, you must vote about it. The reason we're beginning to see some change now is because that is what you did in November. And that is what you did in January. You must continue. That's the end of the beginning, not the beginning of the end. You've got to vote. You've got to take care of yourself. You've got to make an educated decision about the vaccine, a decision that is not based in fear, but that is based in your empowerment, your healthfulness, your knowledge, and as Dr. Deb would say, doing the work. Take the time. It's your health. You need to find out everything that you can find out. But the beautiful thing about seeing you, Dr. Knighton, and seeing you, Dr. McDougall, and seeing you, Dr. Walks, and seeing you, Dr. Deborah Verholzen, is that you look like some child who thinks that what you've done is unattainable. And it's not. I think of Dr. Andrew Thomas. Many of us don't know him, but we should. He headed up something called Project 75. And Project 75, he was a Howardite, and he went to Howard's medical school because after graduating with high honors from the University of Chicago, they would not let him into their medical school. But he never forgot being shut out with all of his brilliance. And he created a Project 75. And this project got more Black people into and through medical school than at any time in our history. Incredible. There's so much that we can do. There's so much that we need to do. And we do hope that you will join the Rainbow Push Coalition. Join the Rainbow Push Coalition. We need your support. We need your help. We need you to follow us on Twitter and follow us on social media. But we need you to support us. We're giving away Pampers, we're giving away food, we're giving away meals because people are in need. We're able to contact and work with a Dr. McDougall and a Dr. Walks and a Dr. Knighton and a Dr. Deborah Verholden because of your support.